Hey everybody, it's Dr. Paul Thomas with Plum Health DBC here in Detroit, Michigan. It's May 6, 2020, and this is my coronavirus update. So far in the state of Michigan, there's been 45,000 cases and 4,250 deaths. There have been 657 new cases and 71 new deaths, unfortunately. Most of this has been centered in the southeast Michigan area, Wayne County, Oakland County, Macomb County, but there's also been cases in Flint and Grand Rapids and several other counties in Michigan. This is up from yesterday. There were only 447 cases and 44 deaths yesterday. So there's still a significant number of cases and deaths today. And if you look at this cumulatively, you're seeing this orange line increasing over time. That's the number of cases. And you're seeing a little bit of a decline over time in terms of the number of new cases. And we're starting to see that trend where the social distancing efforts have been working really well. And some of the restrictive measures that we've placed on society in general, like closing bars, limiting restaurant hours and capacity, have been making a really big impact on slowing the spread of the virus. And also people wearing masks and washing their hands, all these things start to have an effect. Let's talk about testing. Testing has really helped us identify who has the virus and who doesn't. A lot of the nasal swab testing has been done here in Southeast Michigan at places like the State Fairgrounds through the City of Detroit and its partners. And on average, we've seen about 23% or more of the 200,000 tests being positive. And so you're seeing more and more people get tested each day. This was May 1st with right around 11,500 people being tested and roughly 1,000 people turning out positive for those tests. Also, the state and the epidemiologists therein have been looking at when people first started showing symptoms. And this is the new cases by onset of symptoms. So you're seeing, symptoms starting for folks all the way back on March 1st. And then you're seeing a slow tapering of new symptoms or new people getting the condition. Also, this looks at the number of cases and daily deaths. And you're seeing that as a cumulative total over time, daily cases and daily deaths, where we're now getting close to 5,000 total deaths here in Michigan. Focusing in on Detroit, because that's where I'm located. In the city of Detroit, we saw a large spike in deaths in mid to early April, and we saw a gradual tapering of deaths in late April to early May. And this is a big credit to the city of Detroit, the administration, and the restrictions that have been put in place, some of the education campaigns, and the availability of testing. So let's kind of back out to the United States. There's 1.2 million cases and 72,000 deaths. And I really wanted to bring this up in terms of looking comparatively at other countries. A lot of people have talked about how Sweden hasn't locked down, and I wanted to compare the raw numbers in Sweden against Norway and Finland. So we're going to do that now. So if you take a look at Norway, 7,000 cases, 215 total deaths, no new deaths today reported, and this is according to Worldometers. Then Finland, 5,500 cases, 252 total deaths, 6 new deaths today. And then if you look at Sweden, 23,000 cases and 87 new deaths today. And so I think when people hold up Sweden as an example of, a country that didn't do social distancing, I think it's a bad example, and it's an example of what we shouldn't be doing, because they've had dramatically more cases and more cases per capita and more deaths per capita than, its neighboring countries in a similar, cultural and geographic sense. So what happens next? So kind of like right now, we as the medical community are using new tests and new therapies to help people. There's been some reports of new medications that may be effective for the coronavirus, which is great. And as more people become infected, more and more people will develop antibodies. And then perhaps a year and a half from now, we'll develop a vaccine. I actually pulled out a slide that shows a vaccine development timeline. And so The first report of this came out of China at the end of December 2019. The Chinese scientists released the full genetic code of the coronavirus in January 11th. And then in April, we started looking at a vaccine candidate. And perhaps in July, August, we'll start phase 1 testing on vaccine candidates. And then in January of 2021, if everything goes well, we'll start developing the new vaccine. So as you can tell, this is going to be a long process before we have an effective and a safe vaccine. And, the difficulty here is we don't know how well we're going to be able to develop a vaccine. It could be like polio, where we develop a perfect vaccine that works to completely eradicate polio in the United States. Like that could happen with coronavirus. Or on the other end of the spectrum, it could be like HIV, where we really aren't able to create a vaccine to prevent human immunodeficiency virus. That could happen with coronavirus as well. Or it might be somewhere in the middle, like with the flu vaccine for the flu virus. Every year there's a circulating flu. Every year scientists try to guess what strains will be the most virulent in the United States, and they combine 4 strains together. And it usually works pretty well. You have like a 50% efficacy in preventing the flu when you get the flu shot. So it's hard to say what the coronavirus vaccine is going to look like. I'm hoping it's more on the spectrum of polio, where it works very well, but that remains to be seen. One thing that people have said is that I should say a little bit more about my services and what we do at Plum Health. So we really believe in delivering a ton of value for our patients. Instead of seeing a bunch of patients, we keep our panel size pretty small. We take really good care of the patients in our panel. And we're really trying to simplify healthcare for people in Detroit and beyond by removing all the barriers and all the middlemen between you and your doctor. And what that looks like is that you come to us and we help you coordinate medications, labs, imaging services, and specialty consults. And we really save people 50 to 90% on their meds, labs, and imaging services. So we end up saving a lot of people a lot of money. And we take people of all income levels, all insurance levels, and all geographic areas. So what I'm trying to say is that, even if you have insurance, you can still be a member of our practice as long as you're good with our monthly membership, which starts at $49 a month for adults and is $10 a month for kids. And we really have enough time to listen to our patients and really understand where they're coming from and to get to the heart of the issue that they're facing. If you want to know more, we're called Plum Health. We're here in Corktown, Detroit. I also wanted to give a couple shout outs. I wanted to talk about my friend Max at Commonwealth Sewing. They're working on manufacturing masks for distribution here in Detroit. And they're beautiful masks and they're made right here in Detroit. So if you want to support them, they're the Commonwealth Sewing Company. I also wanted to give a huge thank you to Tyson. We were literally running out of masks. We were down to our last 10 medical grade masks in our office, and he came through with 100 masks. I don't know if you remember in my last video, I asked for masks because we were literally running out. So thank you so much, Tyson. He runs the Michigan Urban Farming Initiative. They have a big piece of land in the north end of Detroit, and they grow a lot of vegetables and plants for the community, and they give them out to the community members. So he's already doing great things, and then he came through with 100 KN95 masks for our office. So thank you so much, Tyson. The last organization I wanted to talk about was the MI Face Shields group. They actually came through and they gave us 60 face shields. And these just give us an extra layer of protection when we're taking care of our patients. So this is truly appreciated. If you're a healthcare facility or if you're a bar or restaurant and you want to purchase these, you can do so at mifaceshields.com. I really just wanted to take this moment and thank everybody who's been in our community helping us out. So it really does take a village. So thanks, everyone. That's my update for today, and stay safe out there.